Welcome to another episode of Intentional Living with Emla. I hope you're having a good week so far, and it's always going to get better. Thank you for choosing to spend time with me. And of course, I had to bring back one of my favorite guests. We were just talking off the mic about how many times she has been on this podcast. It's one of my favorite podcast guests now, Dr. Pragna Patel Dadhania. Welcome again.
Thank you. Happy to be here.
If you have not listened to any of her episodes, in this episode, we're going to put in the show notes the episode she talked about estrogen. I think that was one of my favorites. And the progesterone. No, which one's my favorite? Well, we'll just put a link to both on this episode because today we're going to be talking about something. It's not estrogen. It's not progesterone. I'm going to let you guess. Dr. Dadhania is a board-certified OBGYN and a Menopause Society certified practitioner who is deeply passionate about helping women feel like themselves again through thoughtful and individualized hormone care. And this is the reason why I choose to collaborate with her. She's the founder of Modern Menopause Care, and she has intentionally created a practice that gives women, so many of us, what we're missing in healthcare: the time, the listening, and the validation, that personalized treatment. So I don't have any problem recommending patients to go to her. And so we collaborate with her at the pharmacy. When I do your journeys testing and your panel, we test all your levels. If anything looks off to me or you tell me anything is off, it's going to be by force or by love. You're going to have to see Dr. Dadhania. So, did you like what I did there, by force or by love?
Yes.
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 So because we need women to feel better.
Absolutely.
I love that. And what I love most about you is that you combine science with passion and kindness. And that is really what my practice is about. So today we're unpacking the role of, you guessed it, testosterone in women's health. What it actually does, who may benefit, what the research says, the myths, the misconceptions. And this conversation matters so much for women in perimenopause and menopause. So Dr. Dadhania, thank you again for being here and helping us have like these honest, empowering conversations about these hormones that we have not been talking about for the longest time.
Yes. I love to do it. I'm very, like you said, I am very passionate. I love educating and informing women and making them feel like that they have control, because we do have some control.
It is so evident. It is so evident in how you do it. When I went back to the pharmacy after the progesterone one, the girls listened and they were like, it's just so interesting. When you see her, like, you don't think that she has that in her brain. Like, she just walks into the pharmacy so nonchalantly. That's the word they said. They say she just walks into the pharmacy with her backpack so nonchalantly. And then you listen to the episode and you're like, whoa, she's smart. I thought that was funny. So what is testosterone?
Yes. So, I actually went to Google to prepare for this episode, and Google even has it wrong. So Google.
Oh my gosh.
So you can't believe everything on Google. Google calls testosterone a male hormone.
Uh-oh.
But that's not.
She said Google has it wrong.
Yes. So testosterone, it's a reproductive hormone.
Yes.
Women, we also make testosterone.
Yeah.
We need to think about it as it is an anabolic and androgenic steroid hormone.
Hold up. She said Google has it wrong. Google has it that it's a male hormone. She's correcting that. She said testosterone is a reproductive hormone and it's anabolic and androgenic. Break down those big terms for us.
So anabolic meaning we're building up. So think about muscle building. So that's the anabolic component of testosterone. Androgenic implies that it's responsible for some of these male type symptoms. So you can think hair growth is the most common, oily skin. And so this is where testosterone plays a role. And fun fact, we actually, as women, we have more testosterone in our body than we do estrogen.
Wait. As women, we have more testosterone in our body than we do estrogen, like volume, like.
Yes. And it might not look that way based on numbers, but, testosterone is measured in nanograms per deciliter, and estrogen is in picograms. So we actually do have more testosterone. And so I don't want women to feel like this is just a male hormone. It is an important hormone for women, just like estrogen and progesterone that we've already talked about.
We are not 5 minutes into the episode, and I've already learned something new. Do you understand? Do you see why I keep bringing Dr. Dadhania back on this show? Like, it's mind blowing. Every single time I sit with you, I learn something new, you know? So I was like, I was going to say, how do we measure or know that we have low testosterone?
So
Like that from that quantity standpoint.
yes. So,
Mhm.
the only way to really know is, and the most accurate way that we have to measure testosterone is through a lab test, so through a blood test.
Yes.
And I will say testosterone is not usually one of the automatic labs that people have drawn. So, women, we do need to ask for it.
Mhm.
Because I know a lot of times women will go see their clinicians and say something to the effect of, well, I think I may be in perimenopause or menopause, or my periods are off, or something's off, and I want to get my hormones checked. And sometimes when we make that blanket statement, I want my hormones checked, we're not usually thinking about ordering testosterone.
Yeah.
And so it is not something that sometimes is usually checked
Yes.
automatically.
Mhm.
I know for myself, when I see women, my ears kind of perk up and think about testosterone when women start describing some of the symptoms that go along with low testosterone.
Mhm.
The biggest being low libido or low sex drive. So, if
Mhm.
that's anywhere in the equation, if that's something that women that I'm seeing are like, I want to fix this, or this is a major issue,
Mhm.
then that is definitely one of the labs I'm checking if
Mhm.
they haven't come to me with it already drawn.
Okay, perfect. And so you mentioned low libido as one of the symptoms of low testosterone levels. What are some other symptoms which are not so evident, but they're also there, like kind of signal to low
Yeah.
testosterone?
So other symptoms, and again, this kind of overlaps with other things. So it's not just
Yes.
unique to testosterone,
Yes.
but maybe things like fatigue, low energy, maybe some brain fog, maybe some mood disturbances. So again, if this rings a bell, it can go along with estrogen. It can go along with nutritional deficiencies, vitamin deficiencies, stress. So there is some overlap. So that's why, we take a full history, we do all the blood work, because some of these symptoms do overlap with other conditions like, say, low vitamin D, low iron, low ferritin. So those are other, signs that kind of also clue me in, like the testosterone could be a missing piece.
You heard Dr. Patel Dadhania. This is what I'm talking about the testing, and we talk about our journeys at the pharmacy that helps us test all these levels,
Mhm.
the levels that your regular clinician does not regularly test
Yeah.
at your annual wellness visit, because you've gone for your annual wellness visit every single year, but your clinician has never measured your C-reactive protein or like your levels of inflammation, some of those markers. So this is a good time to hear from Journeys. This podcast is sponsored by Journeys, your path to intentional wellness. Are you feeling fatigue, brain fog, low energy levels, and suspicion of inflammation? Most health problems don't start overnight, and neither does wellness. With Journeys, you can take charge of your health before you have to. Every cell in your body is whispering to you. But when we ignore preventive medicine, we wait until those cells are screaming. Journeys helps you listen to the whispers. There are 3 different lab test bundles to choose from. Starting at $199 up to $479, we measure up to 125 biomarkers, most that are typically not measured at your annual wellness visit. Normal labs is not a diagnosis. We get the most complete view, including hormones, nutrient markers that support energy, balance, and healthy aging. Each journey includes a personalized recommendation, one-on-one care from your pharmacist, and follow-up support to turn results into lasting intentional change. It's more than data. It's guidance, accountability, and a partner in your wellness journey. Intentional living means paying attention, staying curious, and taking steps towards the health you deserve. Start your journeys today. Click the link in the show notes. And because it's really important to do this testing, we're going to have a link in the show notes to do this testing so that by the time you come in to see Dr. Dadhania, you have all these levels, because you can replenish, all the regular things. But if you're not looking at the entire picture, you'll be missing the whole point.
Sure.
This is what we talk about whole person care.
Yes. So it's more than just hormones. So, yes, I do appreciate it when, honestly, I do see women from your Journeys program, because I know, hey, if there's vitamin D issues, we're there's low iron and ferritin, we're addressing that. Because all the hormones in the world isn't gonna fix everything if there
Yes.
are other issues.
Yes. They work together. I always say it's an addition to, not
Yeah.
instead of.
Correct.
So we're looking at all those things. Are we addressing the cholesterol? Are we addressing the blood sugar? Are we addressing the high insulin levels? All those things.
Yes.
So I love doing this with you. I
Yes.
honestly love working with you. It was a match made in heaven,
Yeah.
because we're able to help the people from all the directions with all our separate expertise. So how can we replace, when you have determined that, okay, you've rectified all these other issues, and then you come now to the testosterone, how do we replace testosterone?
Yeah, so there's a few different ways.
Mhm.
I would say the most common way and the most, I would say, standard of care way to
Mhm.
kind of replace testosterone, it is transdermally, so meaning
Yes.
through the skin.
Yes.
And, right now the two most common ways that we have is either a gel or a cream.
Yes.
Now, unfortunately, in the United States, we do not have an FDA-approved female testosterone product.
Yes.
A lot of the leading experts in the field hopefully feel like we should have something in the next few years. I hope so too. But again, we are going to have to deal with issues with when there's a new drug that's out, what's access going to look like, what's cost going to look like. So for right now, um, what our workaround is, one is that we can use male testosterone gel, but we dose it for a woman. And for a woman, our dose is about anywhere from 1/20th to 1/10th of a male dose. So we have to do some finagling with the dosing.
Mhm.
When we talk about testosterone levels, for a woman, the normal range for most labs is going to be anywhere from like 5 to 40 or 45. And so what we try to do is get an optimal level. So I know,
Yes.
you talk about
Yes.
this with vitamin D.
Yes.
So optimal levels for testosterone replacement, I'm looking at 45 to 50. So
Good.
you could be at 20, you could be at 10, you could
Mhm.
be at 5.
Still
So
within range, but
still within range
and having symptoms?
and having symptoms, but you may be told you're normal. And so our goal is 45 to 50. So kind of the upper normal limit range for women. Now, to
Mhm.
put it into context, males, their testosterone can range anywhere from 400 to 800. So we're not getting anywhere close to male range doses.
I love that you say that. Thank you for referencing that.
Yes.
Yeah.
So I don't want women to worry about that. But, back to how we replace it, we do use
Mhm.
we can use the male gel. And because it's not FDA approved, it's not generally covered by insurance, so we are paying out of pocket. Generally, it's not inaffordable for most people.
Yes.
Um, and like I said, there are some issues with dosing it, but that's something where the counseling piece comes in. And I really spend a lot of time with women making sure they understand how to dose it appropriately. Now, the other way that you can get testosterone is also through a compounding pharmacy. That is those tend to be more of a cream versus a
Mhm.
gel.
Mhm.
And generally, the compounding pharmacies, they have it packaged nicely that the guesswork is taken out with the dosing. So there's usually a nice little click system and it'll dispense the right amount. And then we can titrate and help you with dosing based on the number of clicks. So those are the two most common ways. Um, We'll talk about pellets a little bit later on, but that is another way that you can get it. Not the preferred way.
Mhm.
I would say the preferred way is either going to be a gel or a cream.
And that is what we do at Power Pharmacy, which will have a link in the show notes too. We receive prescriptions for testosterone for patients when the clinician has sent them after evaluation, and we are able to dispense that in a topic click. It's like a fun, fancy, like a roll-on kind of style. You click if the doctor says click one time, you use one click, and you apply, and then that transdermal absorption to that she was talking about is what we do, or maybe one click to dispense a certain amount, or 2 clicks or 3 clicks based on what your clinician wants you to have. And that's why I'm so passionate about compounding, because we are able to customize that dose, because she talked about the dosing based on your levels and your symptoms. She can customize it to what level that she feels will be a great place for you to start. So she'll start low and go slow, and just to
Yes.
adjust your dose to the person. Like, this is as personalized as it gets.
Yes. And that's really the key is, we just don't check your levels once, give you a prescription, and you're on your way.
Yeah.
When it comes to testosterone, the monitoring is essential. So, we may not be checking estrogen and progesterone all the time, but testosterone, at least in the beginning, does need monitoring. Because some women are what we call super absorbers.
Yes.
So, for some women, taking their dose every day could get them supratherapeutic. So meaning above that 50 level
Yes.
that I'd reference. And so we want to be vigilant of that because the higher we get the dose, that's when we need to worry about side effects. And also by the same token,
Yeah.
we need to check labs. Say for you or somebody and we checked your testosterone and it was 5.
Yeah.
In general, I would say the first time I check somebody's blood work after they've started testosterone is kind of around the 6 to 8 week mark.
All
So
right.
say you started at a level of 5 and you come back and see me and you're like, I really don't feel any difference. And we check your blood level and say we got you to like 15 or 20. So we know we haven't gotten you there
But
yet.
we're moving the right direction.
But we're moving in the right direction because I also don't want to have you go from 5 to 50 overnight because again, that's going to be a shock to your system. And it's going to lead to side effects. And once you have a side effect, what are we going to do? We're going to stop it and we probably won't try something again, even though in the long run it could be beneficial. So monitoring is key. And once we kind of get you at a good level, then I think we can space it out 3 months, 6 months, once a year, or, based on side effects.
I love that. I love how passionate and how detail oriented you are to make sure that this and it's so much easy. As you at that 6 to 8 week mark, you're not doing the whole panel again. You're just looking at that testosterone. How are you doing? And just the biomarkers of concern that time so that you can make adjustments.
Yes.
I love that.
Yeah.
Who would not want to be your patient? I love this. I love the way you practice medicine. I love the way very particular and very specific and explaining very well. I had patients come into the pharmacy and like, oh my goodness, the way she explained it, I really understood it. And I'm like, that's how it's supposed to be. Yeah. So one of the biggest fears that I hear with testosterone therapy is that women are afraid that it's going to make them bulky. Or they're going to have a mustache, or they're going to grow a beard. What do you say to that?
So what I say, that is, one of the biggest myths out there with testosterone. And again, that's where dosing and monitoring is key. I'm not trying to get you into male range doses.
Yes.
We're getting you to the upper limit of normal for females. So we're trying to get you to that 40, 50 range, maybe slightly higher. And that's where individualization is key. Because not only are we looking at the numbers, we're looking at how you feel, and we're looking at whether or not you have any side effects from the testosterone. And so, yes, for you to start testosterone, if you're going to take it transdermally via a gel or a cream, highly unlikely that you are going to get side effects. And initial side effects would be things such as like oily skin, maybe acne, maybe some increase in hair growth on your face. I mean, it's not going to be a full-blown mustache or beard.
We don't want hair.
Maybe some hair thinning on, the top of your head. But honestly, once we get into higher male range doses, that's where the side effects can intensify and sometimes are permanent. So sometimes deepening of the voice, you can get enlargement of the clitoris. So those are some of those things, if they do happen, sometimes are irreversible. And that's something
that's why you monitor very particularly and you stay within those low ranges.
Yes. So I think with testosterone, low and slow is key. And yes, we monitor numbers. So yes, we do need to monitor that. But if at any point in time, if a woman comes to me and gosh, like I'm starting to have acne and I haven't had that, or I've had some increase in, just some hair on my chin, I'm going to be checking a level sooner.
Yes.
Because really issues are going to be there. Chronic exposure to these higher levels. So if you do happen to be a super absorber, we catch it right away. We can, help and reverse some of these things.
Yes. I love that. And this is why if you are listening to this episode and you think, maybe I could benefit from testosterone for that fatigue, low mood and low libido and things like that, first step will be to do a journeys test, to do a comprehensive testing. With the journeys, we test like 125 different biomarkers and test all your hormone levels in there. So once we do all that level and the nutrient levels and all your basic labs, comprehensive testing, and then you follow up with just the testosterone testing if you were to start a testosterone. So monitoring is very important. You heard Dr. Dadhania talk about it. So we have heard people talk about pellets for testosterone.
Yes.
So tell me, what's your opinion about pellets? What do you think?
So, pellets is just it is another delivery system. Of which you can get testosterone. You can actually get estrogen in them too. But I think when a lot of people think pellets, they do think testosterone. Now, pellets are sort of like the size of a grain of rice.
Oh,
it is a
tiny
procedure. It does get inserted, underneath your skin, usually in the buttocks region. A couple of issues with pellets. One is that once it's in, it's in. You can't take it out. So if you have side effects, if you have something like that, or the dose is too high for you, there's nothing we can do. There's no, okay, let's just back off on the cream or stop it for a couple weeks or something like that. Once it's in, and you have to wait for it to dissolve in your body. Pellets do tend to, for most women who do use them, you do get that supratherapeutic range. So most women who do get pellets,
go high.
They are going to be higher than that 40 to 50. I've had women who've been on pellets who've come to me, and sometimes it's been months after it's been inserted, and they're in high 100s, sometimes 200s, and so it does get really high.
Yeah, I'm not a pellet fan.
Yeah, so they can get really high. They're in your system for a few months. So in general, you're going back, at a certain time frame. Usually it's 3 months. And so what happens when it's first inserted, you have some really high levels, and then you kind of have to wait for it to go down, and then you go back and get really high levels. I will say lots of women who do it, I know initially they do feel well when you're getting that high dose of testosterone. They feel energized. Their sex drive is through the roof. But eventually it does come down, and then you have to keep going back. The other issue with pellets, it's costly. It's very expensive. I've had women who've come to me and said, hey, I feel great on them, but it's costing me $10,000 a year. Which, can be a consideration.
Yes.
And like I said, the pellets, because their doses are so much higher, you are more likely to have side effects. You are more likely to have that increased hair growth on your face, acne. Maybe you lose some hair on top of your head where you don't want to lose it. So you do get more side effects. And, I think with the pellets, counseling is key. I think sometimes women don't appreciate the risks and benefits of the pellets. And sometimes when I've seen women and they didn't put 2 and 2 together, like they didn't realize.
They just thought about the convenience of just having it stuck in there and be done.
I've had one time I remember I saw a woman and she had no idea that the changes to her clitoris were due to the pellets that she had been using. And so I think sometimes, just making sure that you're informed.
Education.
And I would say for most women, pellets aren't the first line. They do have a place, but again, trying these safer options first. In my opinion, with testosterone, I think low and slow is the way to go.
She said, with testosterone, I think low and slow is the way to go. I love that. I love that line. That is lovely. So speaking about low and slow, what are some natural ways of increasing our testosterone levels?
Yeah, so good question. So yes, there are things that we can do. They may ring a bell, things like lifting weights, strength training.
Oh, yes.
That can naturally increase our testosterone.
Okay.
Things like prioritizing sleep, aiming for at least 7 hours a night.
Who knew?
Because we do produce it while we sleep. Stress management, decreasing our cortisol levels, because cortisol can inhibit testosterone production.
Wait. Say that one more time. Like, this is all, you're going fast.
Okay.
I'm trying to wrap my head around this.
Yes.
So the first one was lifting weights.
Lifting weights.
Yes. So lifting weights can improve testosterone levels.
Correct.
Very cool.
You're right. And we've talked about lifting weights with bone density.
Yes.
Heart.
All the benefits.
Muscle,
everything comes back to lifting
fat.
weights.
Yes. So, that's why I said it rings a bell. So all of these lifestyle changes, it affects so many different aspects of
Sleep.
our health.
Our body produces testosterone while we sleep.
Yes, so we need that restorative sleep.
This is pretty cool.
Yeah.
Sleep is another one that I
Right.
can't even just, it's
Right.
all comes down. So good
Yes.
restorative sleep,
Yes.
people, it will
Yes.
improve that testosterone level.
Right. And what else does sleep? I mean, sleep helps our mood. It helps our
Yes.
metabolism. It helps our brain fog. It's important for our heart. So
All
it
connects.
helps
Yes.
everything.
All connects and
It
lower
all connects.
cortisol, increase testosterone.
Yes. So why is stress management important? Why do we all need to have an outlet? You know, stress is going to be there by
Yes.
nature of life, but we need to know how to manage it. And again, things like the yoga, meditation, breathing,
Yes.
journaling, spending time outside, spending time with people that we love.
That's
All
it.
of that is it's just so important.
That is so cool. The positive social connection piece there. She just went around and listed the pillars of intentional living and basically said that those are going to improve your testosterone,
Yeah.
like the movement piece, you heard her, inner alignment, measuring all those biomarkers and doing those things that help to align you inside. The journaling, the meditation, reducing those stress levels as you reduce the cortisol levels and increase the testosterone levels and that positive social connection, reducing stress. Like it's all back to the pillars of
It
intentional
is.
living.
It is.
It's
Right.
interesting. Yeah.
Lifestyle really is the foundation for everything and for,
Mm-hmm.
all the major health systems in our body.
Mm-hmm.
And so we need that as our foundation.
Mm-hmm. Well, I have a question for you. Who do you think will be the ideal candidate for testosterone replacement?
Sure. And so, I see this all the time in my practice.
Yes.
I know we've already spent time talking about estrogen and progesterone. And for
Yes.
most women that I see in midlife, that's usually where we start is with the estrogen and progesterone. We're usually not starting with testosterone, but sometimes it is that missing piece. And so, as far as who's a good candidate for testosterone, one, it comes down to talking to the patient. So if I really hear those things, the biggest thing being low libido or low sex drive, because that's where we have the most data that
Mm-hmm.
testosterone can impact. And I do want to emphasize it's not a quick fix, it's not a magic fix.
Mm-hmm.
Testosterone can help sex drive in about 50% of people that take it. So we kind of
Mm-hmm.
call it a modest benefit. So if that is one of your concerns, say, you felt like your libido was great until maybe you hit your 40s, um, and then you notice sort of a change,
Mm-hmm.
that's where I feel like, one, if you haven't had your testosterone level checked, we'll be checking it. And if the lab confirms your levels are low, then we can have that conversation about testosterone.
Mm-hmm.
Sometimes and libido in and of itself is very complex. I know it's kind of outside of what we're talking about
Yes.
today,
Yeah.
but, we kind of look at libido through what we call a biopsychosocial lens, meaning there's a biologic component to
Yes.
sex drive,
Yes.
hormones being one of them.
Yes.
Also, things like neurotransmitters, our overall health, any chronic illnesses, medication side effects.
Mm-hmm.
A lot of the antidepressants, anti anxiety medications, even
Mm-hmm.
birth control pills
Yes.
all affect our sex drive. When we think about psychological issues,
Mm-hmm.
again, we're thinking about depression,
Yes.
anxiety, maybe body image issues. Again,
Yes.
weight gain is also common in midlife. If we're gaining weight, we're not feeling good about ourselves,
Mm-hmm.
our self esteem is low, that's going to impact our sex drive. And then
Wow.
socially, what are our thoughts?
Mm-hmm.
Um, Around sex, be it religious beliefs, social norms, dynamics within your own relationship, communication. So because
Such a huge.
testosterone is
Yeah.
it's such a small component of libido, that's why
Yes.
we say it really sometimes we see this modest
Modest
improvement
impact.
because we need to make sure that all of these other things are there. So, for
Look at that
example,
whole person health.
yeah, because
Mm-hmm.
if there's strain in your relationship, if there's a
Yes.
lot of stress in your life, you're dealing with issues with your children, maybe
Yeah.
you're dealing with aging parents.
Yes.
Well, your sex drive isn't going to be great to begin with,
Mm-hmm.
and testosterone
Mm-hmm.
likely is not going to fix
Yeah.
those issues.
Mm-hmm.
But really looking at it through all those pictures, if you feel like, gosh, my relationship is good, my stress
Mm-hmm.
is average, I'm
Mm-hmm.
not overly worried about something, my medications aren't affecting, my sexual function, and I'm in that perimenopause, menopause stage, oh, my labs show that my levels are low, then yes, I think you are a great candidate to start it. Like I said, sex drive is where we have the most evidence for it. Anecdotally, I will say women do notice improvement in other aspects of their life. Some women will say they feel more energized, fatigue is less, improvements in sleep, improvements in mood, improvements in helping with building muscle, when they're doing their strength training and prioritizing their protein. So sometimes it is that missing piece for some of these other issues that are going on.
Wow. I never heard that word before. Biopsychosocial.
Yes,
So comprehensive.
it is.
So comprehensive. And the way you explained it, it's really just, it's evidence-based, just telling us all the components, and that testosterone is one piece of the entire puzzle.
Right. So if I see a woman and she reports low sex drive, I'm really digging in and seeing what is the relationship like? What is day-to-day life like? What is stress like? What are the other medications she may be taking? So, these are all other considerations, because if those are there, then she may not benefit from testosterone.
That is wonderful. And this is why I recommend, if you have listened to this episode and you're thinking that, maybe I can benefit from testosterone therapy, first thing you want to do is do your measurements, do your test. We're going to have a link to Journey's on the show notes. Schedule that link, and then do the comprehensive longevity and hormone panel. And then we'll be able to look at all those 125 biomarkers. I'm going to sit down with you, go through those results, and explain them to you. And then Dr. Dadhania is going to sit down with you, ask those questions, and explain the hormone aspect to you and what she has in her toolbox that can rectify some of those for you, in addition to the questions that she's going to ask you, all that intake and that history. So this is really important. Please share this episode with as many people as possible, because people need to be learning these things. Like Dr. Dadhania said, the most powerful tool we have is education.
Correct.
She went on Google to just say testosterone, and she said Google had it wrong. Just imagine that. So we need education from people who have the training to be able to teach us evidence-based medicine.
Yes.
So that is why we keep bringing you on the podcast. Yes. Have fun, everybody, and share this podcast, Apple Podcasts, Spotify, YouTube. Share with friends and family, and continue to live each day with intention.